It is important to highlight that gene testing is just one of the tools that we use in our inherited cardiac diseases clinic in order to diagnose individuals and offer them the best possible management. Whether your physician will recommend gene testing will depend on the condition identified and also on your individual circumstances, and in particular what is going to be the impact of a positive or a negative result to you as an individual and to the wider family. There are certain conditions such as long QT syndrome where a positive gene test is highly likely if the condition is evident on your 12-lead ECG, and you may be able to get a positive result in up to 80% of individuals. So this is an investigation worth doing in someone with long QT. In addition, we know that if you've got young children, and even if they have a normal ECG, by identifying a positive gene in them, you're able to give them medical treatment such as simple medication, beta blockers, that will reduce the risk of an irregular heartbeat that may predispose them to fainting episode or sudden cardiac death. As such, if we've got an individual, a parent, who has been diagnosed with long QT syndrome, we know that if we perform gene testing, we've got a very high chance of identifying positive gene, and we can then use that gene to test our children irrespective whether they've got symptoms or not. On the other hand, we've got conditions such as Brugada syndrome, where unfortunately the yield of genetic testing is very small, 20 to 30%, which means that the majority of individuals identified in our clinic are likely to have a negative gene test. In addition, we know that the majority of individuals with Brugada syndromes who do not experience symptoms are unlikely to be at risk of experiencing irregular heartbeats, particularly in the context of a normal ECG. As such, an argument can be made relating to Brugada syndrome for being a bit more cautious and conservative as to who do you do gene test on and what's the impact of a positive gene in their family. And this is particularly relevant in today's era where our national health system is considerably constrained relating to financial resources.